for being able to join us. My name is Akayla Galloway, and I am the Policy Fellow at Sister Love. I am joined with my co-host. I will pass it over to her for her to introduce herself. Sally.
Hi everyone, my name is Sally and I'm the PWN Legal Fellow and I'm happy to be here.
Yes, and we're going to pass it over to our panelists who are here to join us. Please let us know your name and the organization you are representing today. I'll start with Antoinette.
Hi everyone. Can you hear me?
Yes.
Okay. Hi everyone. My name is. I am a HIV peer specialist and advocate. I am also a mother, and I am a breastfeeding advocate for people with HIV. And I'm so happy to be here. Thank you.
Thank you for joining us. Kamaria, sorry.
No worries. So happy to be here. I'm Kamaria Laffrey. I use she, her pronouns. I'm a woman living with HIV, and I'm the program director at the Sarah Project.
Thank you so much for being able to join us. We really appreciate your presence. I just wanted to start off this conversation by saying that this is an event for Black Maternal Health Week, which is organized by the Black Mamas Matter Alliance, and is a week of awareness, activism, and community building aimed at amplifying the voices of Black mamas, bringing visibility to Black-led maternal health initiatives, and centering the values and traditions of the reproductive and birth justice movements. This year's themes focuses on Black Maternal Health Week theme focuses on building for liberation, centering Black mamas, Black families, and Black systems of care. And the purpose of this conversation is centering the lived experiences of Black women living with HIV, working in HIV advocacy, and doing the work at the intersection of reproductive justice and HIV. Black women historically have been the anchors of their families, communities, and the systems of care of others. Black birthing people should be seen, embraced, and supported at all stages of their lives. And I'm going to pass it over to Sally for our first question of the panel.
Sure. So our first question is a pre-question, but if both of our panelists could just explain to us, what is reproductive justice to you? Kamara, if you want to go first.
Yeah, sure. So that is very broad. So I'll speak, from my personal experience and just how I've seen it show up in the world. But beyond, I guess, a definition, as a woman living with HIV, it's not just about the fight and the amplification to make choices on reproductive and sexual health, but it's also influenced by the choices made and access to those resources. So access to healthy foods for lactating parents, that's reproductive justice. Affordable and safe housing, that's reproductive justice. Or being even able to qualify for affordable and safe housing programs is a form of reproductive justice. There's a lot of layers too. I mean, it's access to your human rights, and it's having the full choice to be able, the full autonomy to be able to make those choices without being policed or penalized. So I'll stop there.
And really quick, I just wanted to reference that Ms. Martha was able to join us. If we could have your introduction and your organization before we kick off the panel.
Yeah, mute.
Her, hers, and I represent two beautiful women's organizations. I'm the Special Projects Coordinator for PWN, and I'm also working with the International Community of Women Living with HIV in North America. Thank you so much for having me.
Thank you so much for joining us. Would you like to tell us about your definition of reproductive justice beyond those three tenets?
Wow. Especially, and I think Kamaria covered, some of the layers, but I look at reproductive justice, especially for women living with HIV, as just having the right to be a mama, like every other mama, free of discrimination, free of just the despair and mental health issues that come with, the idea of all the information that you have to digest in order to believe that you can have a child, even in the world where we know we can have children that are free of HIV, and the free and also just the freedom to have a family. And so it's so many things, but I really would love to see women coming behind me just being free to be mamas like everybody else.
Thank you, Martha. I think this is a perfect opportunity to ask Antoinette, why is it important having these conversations about HIV in reproductive justice spaces? Why is that important?
So just piggybacking off of what Kamaria and Martha is as far as like to have access to all. It's important to have these conversations like why is HIV integrated or intersectional with reproductive justice, access and rights, how medications affect our bodies, especially when you think about being pregnant and carrying and bearing children. How can we birth these negative babies, and how can we now expanding the conversation into breastfeeding and what that looks like. So they work hand in hand, and it's about having all the information that we need in order to live holistic and fruitful lives for ourselves and our children and our communities.
Yes, I honestly agree with everything that everyone is saying. And so before we get into talking about chest feeding, breastfeeding, I would love to pass the torch over to Kamaria to explain to us a little bit about HIV criminalization. So then we can talk about actual policing, and then we moved into how our bodily autonomy is policed.
Sure. So HIV criminalization is the misuse, in my opinion, the misuse of laws that are being enforced to criminalize behavior that otherwise is not criminalized. So having consensual sex is being criminalized. Enjoying your body and navigating pleasure while living with a chronic illness is criminalized in many states. Choosing to breast and chest feed, which we'll get into, there's no statutes. There's not actual legislation that says parents can't breast or chest feed, but there are guidelines that help support the influence of medical providers to dissuade parents from being able to make that choice. So their autonomy is taken away. So HIV criminalization in a more specific way is there are statutes, at least in 30 something states. There is a state that's I don't know if I can say it publicly yet, but they are on the cusp of passing some really powerful, meaningful reform. And we've had success in folks making changes in these laws during a pandemic. In Virginia, Illinois made a full repeal of their work. So there's a movement of this reform being changed. But meanwhile, we have got to be more intentional about the systems that are in place that encourage these laws, because people, while we're waiting for the laws to change, people are still being criminalized, people are still being locked up, people are still having their lives turned upside down. And in my opinion, it's an act of violence, the way these laws are being utilized, that go against public health to help encourage people to know their status. It punishes you for knowing your status. So I want to stop there and kind of leave it broad for people to be able to ask specific questions later. I don't know if we're doing questions and answers, but.
Yes, for those of us who are joining online, feel free to drop your questions in the chat to engage in this conversation. It is happening live. And yeah, so talking a little bit more about the policing of bodily autonomy, I would love to invite Antoinette to speak a little bit about what chest feeding or breastfeeding is.
So breast or chest feeding is having the opportunity to feed your child the breast milk that comes from, the bodies that we have. And what that looks like, at least from my experience, is having a care team to support you in that journey. So for me, I had like two different sides of feedback. So I had my OBGYN from the time when I was carrying my baby of like, yeah, we kind of support it, but we want you to understand the risks that come with breastfeeding. Um, and I had folks in that same space who was like, no, we completely do not support this. And we can't really assist you on how to navigate your journey throughout this. It took me finding and advocating for myself with my child's pediatrician, with my own healthcare provider, and them working together with the OBGYN to develop a plan that works best for all of us. Because from the start to the end, I was very adamant about I'm going to breastfeed. And the only thing that I need from y'all is the support and to make sure that I'm maintaining my viral function and that I'm staying on top of everything that I need to for myself. So that's what it looks like. But you see that in different states, that's not always supported. So places where there's not a lot of education around HIV and transmission, the conversation usually stops at like, if that's a choice you make, then we are going to proceed with getting legal involved. So like myself, I was advised not speak on breastfeeding, delivering my child. One of the nurses would call CPS on me. And that's something that we see very often because there's a lack of education from all of the providers in the hospital spaces. So some are advanced, some are not, some are trying to make decisions for other people's bodies. Some are like, yeah, I totally agree. So it's no like commonality amongst anyone. And that's where we're seeing a lot of the back and forth around breastfeeding and chest feeding.
To piggyback off what you said, Antoinette, thank you for the answer. Can anyone speak to what this does to the Black mama and her children? Like, what does this do to the family dynamic, and how are the families and systems of care impacted?
Oh, wow. That is such a loaded question, Sally, because, my experience, first of all, just thinking about being pregnant and everybody, including some of my family members, feeling I had no business being pregnant as having children as an HIV positive woman. And some of that was, in a silent way. But for my OBGYN, she came outright and told me that I had no business having children. This should be my last. This was when I was pregnant. And up until she was delivering that baby via C-section, she wanted to tie my tubes. This issue has been ongoing in our community, in the Black community, where there is a very huge bias against us having children for many reasons, the top of which is just embedded in structural racism. But that did a lot to my mental health throughout my pregnancy without having the real information that everybody has now, that there was no chance as an undetectable woman I would ever pass that virus on to my child. In 9 months, I kept thinking about that. And so even when I was threatened with the fact that if I even thought about breastfeeding, I would be introduced to CPS, and I wasn't familiar with CPS at that time. It was just one of the scariest things. After I did have my baby, I did not breastfeed but I did get visits from the health department, and I never understood what those meant until now. As Antoinette is saying, there are many young moms that are part of a support group that was started by a young woman called Heather O'Connor, who was part of ICWNA. And in this movement, we are hearing so many cases of young women literally being told, including Heather herself, who, when she called the lactation specialist, was told she would not, that they would call CPS on her. And what does that mean? What does that mean when they say that they're going to call CPS? It basically means that, according to the guidelines, you are putting your child at risk. And risk is a very big word, and they threaten that children can be taken away, which of course breaks down the family and separates you from your child at a very critical moment. We've only heard of this happening once. In other cases, like Kamaria was saying, it has been a loophole, right? So they'll say, oh, you're not supposed to breastfeed because of your viral load, and we're going to check that. And they'll say, well, your viral load was actually fine, but we did find a history of substance use in your history. And so this is what we're going to do about it. So it is this underlying stigma, discrimination, and outright, criminalization of Black people that extends to this, to mamas, just at such a critical time when it shouldn't be happening.
I would like to ask a question of Kamaria about the impacts of policing already over policed Black people and what that does in HIV work.
I can speak from the experience of like trying to be a outreach worker with the brief period of time I did it, and having conversations with folks who didn't know my status as I was facilitating, a training about, condom negotiation and sexual empowerment. And when it came time for questions and answers, convincing folks like afterwards as a closeout, like, we have a testing booth outside, so please, feel free to be tested or whatever. The looks I would get. And I remember one time I just volunteered. I already knew my status, but I was like, let me just show y'all, because someone said the test wasn't accurate. And I was like, I'll show you the test is accurate. So I literally just swabbed, and within seconds, of course, it showed that I had HIV, and that opened up a whole nother conversation. But the fear that came up in that, and the my recognition of the disenfranchisement of my Black community was heartbreaking. And it literally made me not even want to do outreach and testing anymore, because I was like, there has to be another way I can impact and help my community. There has to be a conversation around healing. So whenever I do a conversation or a training on criminalization, when I'm talking about the laws and the statutes and the penalties, I give folks a minute to breathe and take all that in and wrap your minds around that. And I feel like we're not doing that enough in our communities. And healing and processing looks different for each of us. And it's not always going to a counselor. That's not always the go-to. Sometimes it's just having a space like this to be able to talk and realize you're not alone. It shifts how you even look at your body, so that you can understand how to move in your body, so that you can recognize that no one can tell you what to do with your body. It's processes. I had to go through that journey. And I didn't know my status when I had my daughter. So that was a whole mental health thing that I had to wrap my mind around in 2 weeks of being told not to breastfeed after I was trying. So that's from a training and facilitating standpoint. And then from a personal standpoint, the impact of criminalizations, I always have this weight on my shoulder that it's my sole responsibility to protect the entire community from HIV. And that the consequence will always be that I'm the one that's subjected to going to prison, not that I ever have an opportunity to have justice for me. So the laws and this enforcement of these laws is not equitable. They're unjust, and they're really, as I've said before, and I'll keep saying, these laws are a form of systemic oppression and acts of violence, the way they're being utilized on people.
Thank you so much, Kamaria, for sharing that. I want to really ask you all, what does it look like? What does it look like for there to be the support that you wish you would have had during pregnancy and during delivery and during your lactation periods? Like, what would you have really wanted to see from all of these systems, and how do you see that transforming into the future?
Yeah, I could answer that a little bit, and I think I've heard Antoinette speak to this really well as well. Um, but it actually pains me to see that my youngest is 12 years old now, and it was 12 years ago I experienced this, and young women still coming before us are experiencing this. So, part of it is for us to establish, for us to abolish some of these guidelines, and for us to create this triage of support that Antoinette was referring to, between your infectious disease providers, your OBGYN, and the people that handle the children, so the pediatric specialists, the lactation specialists, that somehow all these people are in the know with the updated science and how to support a woman living with HIV through all the way from, getting pregnant, pregnancy, all the way to having your baby. It should be seamless, because for as long as you're taking your medication, which part of that, you need support as well through this. Being pregnant and having a child is a very traumatic, experience in itself. It's beautiful, but it has its, trauma. Yeah, birthing a whole little baby coming out of you. So you need that support, and so that needs to be embedded in the case management around people that work with women living with HIV, pediatricians, as well as lactation specialists, because trying to get a baby to latch is very, very hard. And I'll just add a little bit quickly about our trans sisters that are also trying to do this, the chest feeding with the even heavier layers of stigma and discrimination, and that there just needs to be expanded education and language, and for all the providers, in order to respectfully and culturally address anybody that is going through a pregnancy and birthing experience. Unmute. No, we can't mute.
Okay. Everything that Martha said was pretty much right on the nail. The type of experience or the care that I would have liked to receive would have been more of a supportive, more communication, like she said, from the infectious disease doctor to my OBGYN to my mental health care specialist to a lactation support. And it's not that I didn't get it, it's just that I got that support after the fact, after I had to advocate for myself and to really prove that I know exactly what I'm talking about and I know my research. And it's unfortunate that my experience is I want to say one of the good ones compared to some of the stories that I've heard that many people had to go through. And we want to, for me, my provider, my child's pediatrician, and my doctor both had experience. They teamed up to be my care team because they both had experience with working in different parts of Africa with the women there that they've been breastfeeding for multiple years. So they are advocating in a way where it's if they can do it in Africa, and we've been a part of this research, why can't we bring that same thing to the United States? And I'm always speaking them up because I'm well, why aren't y'all facilitating trainings to all these other doctors who don't get it yet, who aren't on the same page as you? And that's where it's it's lost in translation. So it's more so of how can we include them into these type of conversations to push for more advancements in other states along with Georgia. So.
For me, to Antoinette's point, I feel like we just have to keep making noise. We have to keep leveraging our lives as people living with HIV as subject matter experts to make policy makers uncomfortable with the decisions that they think are just, reminding them that they're not, and keep giving the examples of how problematic these policies and the vague thread of policies are. Because again, the chest and breastfeeding doesn't have a statute to it. There's not like a database that's collecting yet of voices and people that are being impacted by that threat, but it's happening. There's cases that are happening all the time, to where women or people who have the ability to birth a child or feed a child through breast and chest feeding are getting educated about viral suppression and the levels of the options they have, I should say, and that they're learning this in the midst of their pregnancy, and then they decide, and then their lactation team or their medical team might turns against them. And so we have to continue to just be loud, make the noise, keep educating. And definitely I'm all about making people uncomfortable to get my point across, for if it's going to lead towards effective change. Like, you're going to be uncomfortable until we get this right, because I'm not free until all of us are free. So I'm not just advocating for me, I'm advocating for everybody. So we can stop having these same conversations all the time. But that's just
Thank you all for those answers. Michaela, you want to go with the next question?
Yes. Martha spoke a little bit about it earlier. I wanted to dive into a little bit more about the language surrounding chest feeding and breastfeeding, and making sure that we are being gender inclusive, and making sure that we are including everyone in the conversations. And what does that look like? So whoever would like to touch on that aspect of it.
Trying to make sure I wasn't muted. Yeah. So, we actually had a class, or not class, so a webinar on, just language and the issues of being inclusive and respectful. And in our community, we know that it's still possible for trans men to choose to have children, and to be able to breastfeed as well. And it's called chest feeding because the trans folks who are trans men choose not to call it breastfeeding. Right. And I think that's a way of being respectful, depending on how you view yourself, how you identify yourself, and how we need to be respectful of that. And so that is the only difference between the breast and chest feeding. It's also possible to just, the connection. I think one of the things that we don't really talk about a lot is just the benefits, the huge benefits of breast and chest feeding to the baby, to the mother, that, prevents all kinds of illnesses in the children, including even preventing obesity, and issues like that. And then in the mamas, it prevents cancers, ovarian cancers and so on and so forth. And, nobody should, not be told about those benefits and should be denied those benefits. So I think it's really beautiful for us as a community to be able to model the language, and to be able to be inclusive, and to be able to reflect it so that others can follow our lead. And so we are very intentional about using breast and chest feeding to be inclusive of trans men that have chosen to birth and chest feed the children.
Thank you, Martha. Something that comes up for me is that, this is something that's been a movement within reproductive justice for a while, being inclusive of all genders. And I kind of want to ask you all, what do you see as some common issues that could come up, or some disparities that could come up as a person of trans experience going through pregnancy and going through a chest feeding process?
So I wanted to just say, like, something that could possibly come up is not having a doctor who understands the experiences of trans people, or people of trans experience, that understands how maybe their HIV medications could affect their hormonal medications, that could affect their delivery and so forth and so on. But I feel like it is best when having these conversations to have somebody of trans experience in the space to better answer the question. So when I think about it, I just think about all of those needs to be sure that all of their needs are truly being met in the best way that they can possibly be. And that's not always possible when you don't have people with experience of working directly with that community.
I would agree with that. We need more gender affirming spaces for people of trans experience, so people aren't misgendered or told that they shouldn't be having children because of how they present themselves or even because of their HIV status. It's not my lived experience, but it's one that I try to speak and bring with me when I'm talking to other service providers about the issues that people with trans experience face. And the fear, like just the fear of like getting yourself ready to go to the doctor. Like I experienced that. So I can only imagine of like being faced with like potential violence of once I get to that provider's office, that even just sitting in the lobby. And how is that set up for me to feel safe? Because we're so conditioned in society that we have these gender norms that actually work against people feeling whole and authentic in their movement in life. And so even just thinking about how is your clinic lobby set up for people to feel safe can be one thing that service and medical providers can think through. So that's just some things that come to mind for me in agreement with Antoinette.
And I think I'll just quickly add, that especially as a Black community, we also come from these backgrounds of faith. And I think that we really have not talked enough about it and thought enough about it, of how to build safe spaces within our families, within our faith circles, and how we model it as people who understand, the language, understand all the justices that need to go with this issue. And so I would even encourage, just more conversation. I always call myself the unofficial counselor for families that may have trans or just other, members of the LGBT community in their families. And it becomes a real challenge to have those real conversations, but I have chosen to model it, like with my family, in terms of acceptance, in terms of language as well, that they need to understand, they need to be little advocates. I've always told my kids when they go to school, if they see anybody being bullied, this is what they're going to do. And they understand this because of what is rolling out in our communities and in our world. So just to also, really encourage that kind of conversation, because I think we need to model acceptance and love.
And I just want to add to that. I think a part of the conversation that should also be umbrellaed in this is even those who choose not to have children or aren't able to, but don't want to disclose that. It's really none of anyone's business of why someone chooses or doesn't choose or is not a parent. And there's another aspect of that with women living with HIV. Like I know women living with HIV that do not have children and are working amazing careers, but cannot access the services and resources because of their income bracket as a person living with HIV. And then they're having to shell out of pocket for their medications and meeting deductibles on insurance. And we're not talking about that enough either, that's a form of isolation. And, oh, well, you don't have kids, so you don't qualify for this program. And that just blows my mind. And I think we need to incorporate that piece as well. And Martha, I will say you hit a nerve when you brought up the faith community, because that is another piece where, can we just normalize that people have sex? Can we just have real conversations that pleasure is pleasure, and that there doesn't always have to be a predator involved for why you got HIV? There doesn't always have to be this victimization of people around HIV, and that a testimony doesn't warrant the fact that you were victimized. A testimony can just be because you overcame any challenge that happened in your life. So I'm hitting a lot of, I was triggered. So I'm saying a lot of things that, I'm speaking to things that were said to me, but I just really feel like the faith community and the Black community really has got to do better about having more affirming and not wholesome, but affirming and helpful conversations towards our community, no matter what age they are.
Yes, to all of that. I think that speaking about these conversations is what we're here to do. We are in the SisterCircle. So this is a safe space where we have these conversations and we're able to unpack these things. Antoinette had to run because of the baby, which brings me to my next round of questioning, which is about what are some of the experiences with decision making when you first learn about your pregnancy? What are some of your biggest concerns at the beginning of your pregnancy, whether it is wanted or unintended, planned? Let me know your thoughts.
I'll jump in. Well, you already said what my personal thing was. My baby was a surprise. I only have one daughter, and she was not planned. I did not plan on motherhood at all, because of I was trying to break generational curses, and I was like, well, I'll just start by not having children. But universe saw different, God saw differently, so. I remember being torn on whether to go through with the pregnancy and struggling with my faith and how I was raised and not understanding, what autonomy looked like. And really, I think that was one of the biggest struggles I had of I want to make this choice because I'd already made this other choice a long time ago. And actually I found out that I was pregnant the day I went in for birth control. So they're like, it's too late, honey. But that was a result of another delay in systems. I went to the health department to get the birth control appointment instead of just being able to walk in and get consultation that day and set up something the next day. There were a lot of barriers because I think I was 18, 19 when I went in for this appointment on a college campus. So at a HBCU. So they were putting up all these moral barriers for me that delayed the process. Meanwhile, I was still having sex. So yeah, some of those challenges is do I want to be a parent? How am I going to safely bring this child into the world? And am I the right person to ultimately be with this human for the next 18 years? I don't, I had to learn through my experience because I was very judgmental. So I'm being very transparent here. I used to be very judgmental, and I used to be a pro-lifer without really knowing what that meant. Not understanding what having the choice and what having autonomy meant. Autonomy was not a word that was used in my sexual education upbringing. So I'm grateful for the struggles that I've gone through because it's made me an advocate and it's made me more compassionate towards others.
Yeah. And so with me, I was one of those that had always wanted to have children from a young age. I knew I was meant to be a mama, and raised in the church too, and definitely having sex on Saturday night and going to church on Sunday, type of thing. And so, when I contracted HIV, it was very clear the reaction that you're talking about, and the religious trauma that we don't really know about. But when my husband decided to marry me, I decided that this was going to be my advocacy. So I did, as an HIV positive woman, go back to church to get married, and I wanted everybody to know that that was happening. And so it faced its own challenges there. But they announced it in church. I asked the pastor to say, because they might be wondering, does he know? So make sure you tell them that he knows she's HIV positive, and then came the babies. This was in Africa. So flip the script now and come to the US, being in an interracial marriage and just experiencing firsthand some of the structural racism that goes with being, Black, and then, then being HIV positive in a very conservative white family. So I feel like gone against every kind of stigma and discrimination that there has to be. And my sole purpose now is to ensure that nobody else has to experience that. I have stood my ground about who I am, that HIV doesn't define me, that there are two beautiful boys that are evidence of the fact that there doesn't need to ever be vertical transmission of HIV to children anymore, and that we should be allowed choices. That is what sexual and reproductive health is all about. Justice is all about. So we just use our lives. That's what we can do in the small spaces that we have. We use our lives. We do that advocacy. We break these barriers and myths. But unfortunately, in some places, I've been to the southern United States, it might take a generation to change some of this stuff. But it's just one person and your circle at a time.
Thank you both so much for sharing your stories. There's so much power in storytelling and using how you both have used your stories to enrich the lives of others. It's so powerful. I want to talk a little bit about what type of work is being done in these spaces, in the spaces that we're in these HIV and RJ spaces, to ensure that change is being created and that, we can see some of these things that we envision happening, hopefully not in a generation. So someone could kind of just give us an idea of like what type of work is being done.
Absolutely. Yeah. Well, I can quickly share how we have been doing this advocacy to change these guidelines that essentially guide the providers. Once a provider looks up breastfeeding and HIV and they see do not, on our drug labels, do not breast, all of that. We took up that challenge with, various partner organizations, the World Project, CIRO, PWN, we're all fighting this. And the idea is, at the very least, we're really showing that there will be at least some change in the language. The inclusive language, we're getting that in there. And we're also getting in the language of choice. Right now they're not saying they're going to allow exclusive breastfeeding, but they'll show that it's a choice with the correct support. And I think that's going to be a huge win for our movement, at least to start. Soon after that, we need to do the research to ensure that the U equals U language now begins, as Antoinette was saying, to include breastfeeding, because it outright says U equals U, except for breastfeeding. And yet the research that is already there from Africa, like Antoinette was saying, clearly shows that the transmission rates are very similar to what was there when they did the U equals U research. And so they were able to say U equals U for sex and not for breastfeeding. So that's kind of some of the work that is being done specifically in the breast and chest feeding world. I'll hand it over to Kamaria.
Kamara, before you go, Martha, can you just explain what U equals U is to folks who may not understand that?
Absolutely true, and I apologize. So undetectable equals untransmittable, meaning that as an HIV positive person, if your virus falls below undetectable levels in your bloodstream, which is what, is the goal whenever you're on medication, you essentially become like in remission. It is impossible. We now know scientifically that you cannot pass on the virus. And that is the basis of even what the criminalization work, and I'm sure Kamara can speak a little bit about that, but you shouldn't be criminalized for that anymore because you cannot pass on the virus for as long as you're undetectable.
Yeah, and I'll just add like a way to measure that for folks living with HIV. They're like, what is this U equals U? If you're on your treatment for 6 months or longer, it's typically like the window range, I guess. And then also acknowledging that not everyone can reach undetectable viral loads, which is another reason why the way the laws are written are really problematic, because we're not trying to create another class of people to be penalized.
Right.
We're really wanting folks to look at intent and whether transmission even occurred. There's people sitting in jail right now that were accused of non-disclosure. Their proof of disclosure wasn't accepted. Transmission never occurred, but because of the way laws were written, they still got sentenced to 30 plus years as a felony in their state. So that's just a broad popcorn example of how dangerous these laws are. But some of the other work is it's a very large document, but I'm really proud to have been a part of the group that put it together. But we have a policy agenda on a federal level written by people living with HIV, listing out demands to our federal government partners that are the ones kind of being the beacon of these policies that trickle down to a local and state level. The document's called Demanding Better policy agenda. And it's literally not a request. It's not asking for permission. It's demands. It's flat out demands. We're 40 years into this epidemic and we're tired. Some of the other work from that, well, inclusive of that, it's one, training people and educating people on the components of Demand Better policy agenda, on how to take it to like their local planning bodies and their service providers and their community, and being able to articulate what's in this agenda and learn like how these things are impacting their lives. So from criminalization, quality of life, molecular HIV surveillance, a lot of things that we haven't touched on here that I'll be happy to speak to in another space if we have more time. I'll speak from Sarah's standpoint as far as doing the work. We really strongly believe in the leadership of people living with HIV as subject matter experts. So through our collaboration or collective with the Health Not Prisons Collective, which is the U.S. People Living with HIV Caucus, Sarah Project, Positive Women's Network, Counter Narrative Project, and Positively Trans, or Transgender Law Center, apologies. We come together and help equip people living with HIV that are either joining coalitions or brand new to advocacy and starting a coalition, not just by telling them to go to meetings and take notes and report back, but actually providing them a stipend because this is volunteer work. This is heart work. You have to have a heart for it. It's hard work, and you need to be compensated for this emotional labor that we put into this. So we try to, raise funds to be able to equip advocates. There's also just most recently, the HIV is Not a Crime Awareness Day launched this past February, as a way to equip advocates that are talking to legislators and engaging with those policy stakeholders by using an awareness day during legislative session to help drive home the points of specifically how HIV criminalization impacts Black, Indigenous people of color, and women. So the day of February 28th was selected to kind of be a centerpiece to National Black HIV Awareness Day on February 7th and Women and Girls HIV Awareness Day on March 10th during Women's History Month and Black History Month. So that Awareness Day is a tool that is being developed even more, and federal partners have engaged by supporting that Awareness Day as well. So that's some of the work that's being done, is that we're being heard. We're just looking for the meaningful involvement part, because people can hear you and rubber stamp what you're saying and nod that it's a good idea, but to actually engage us in funding opportunities, not just giving us the money, but actually letting us put the language in for what that funding looks like and how it should be distributed into our communities that serve and impact us, is another piece of that work. I can literally go on and on and on about all the work, but I want to also pass it back to Martha, or also save time for other spaces. But there is plenty of ways for folks to engage and activate in criminalization reform.
Yeah, we will definitely keep you posted, because we really want to expand on the conversation around breast and chest feeding and make sure that it is being viewed in a repro justice and racial justice lens. It absolutely has to, and so far it hasn't. We are pushing and we are getting the language in there, but we need even our community to understand how this affects us and what we can do about it. Antoinette was able to advocate for herself because she's in a space where she has access to this information and this advocacy. And all the rest of the women that she was referring to just do not have the information. And so we really need to do that advocacy that Kamara is talking about at that federal level, and then we need to have sort of this sort of grassroots advocacy as well, and education. Yeah.
I have one final question that kind of speaks to everything that you were saying, especially about centering the voices of those most impacted. How do we get those seats at the table? We know Kamaria is not afraid of making people uncomfortable and making sure
No,
that she
she's
is
not.
taking up space. So what else do we do? What are other strategies that you?
I feel like from someone working in this space of policy, which I have no background and training in, it was a survival thing. Like, okay, this is what's happening in Florida. Let me show up. But for folks that are looking like, how do I navigate? How did you know what right person to go to? I didn't. I went to everything. So I really wore myself thin, just literally saying I had a season of I just said yes to everything until pieces started fitting together. I honestly don't recommend that for everyone unless you're like really ready, because that's exhausting. But one thing I would say that will be helpful for me to like know where to navigate people is hearing stories, like hearing, what are you experiencing? I'm not trying to be in people's business, but like, what are you experiencing when you're having conversations? For example, like if you're switching your insurance company, how does that shift the conversations you're having with medical providers? And whether or not you even continue to be consistently in care. Or does that mean you have to go to a completely different location because you live in a rural area and you're limited to only 2 options? Or are you feeling oppressed by your case manager because you want to speak out at your coalition about a certain issue, but the coalition is led by your ASO, so you feel like you can't say anything? So hearing stories and hearing how people are navigating around or are not able to navigate around is super helpful for a lot of organizations to be able to like gather stories and gather data so that we can take it to federal folks, legislators, other decision makers, and not just be the only ones saying this problem is happening, but we need support in the proof. Being able to say this is happening in Louisiana, this is happening in Georgia, this is happening in Ohio. That's one way. And of course, just, emailing us or contacting us. There's also HIV is Not a Crime Training Academy is in gear to happen June 3rd through 7th. I might be wrong about the dates, but it's being hosted in Virginia. And this training academy is led by people living with HIV, for people living with HIV and allies and stakeholders to come together and have conversations around the nuances and intersectionalities of criminalization, breast and chest feeding, maternal health, racial justice, immigration, language justice. All of that is included in this training academy that lasts for 3 to 4 days. So that's another way to get connected. And we really focus on state by state level advocacy. So if you're coming from Kentucky and don't know any other person with HIV in Kentucky, I guarantee you will find that individual at the training academy. And those are just some examples.
Yeah, I would just add, and I know we're out of time, the World Project on their website have a lot of resources, including some of the stories that Kamaria just mentioned. And the ICW North America website has links to the Milky Movement, which is for mamas. It's a safe space for women thinking about or intending to breast and chest feed. And the reason why it's very difficult to get those women out now is because of the guidelines, that they're afraid. But the Milky Movement group is a safe place to be, where you can ask questions and be referred to resources.
Thank you guys both for being able to take the time and have this conversation. Thank you so much for your transparency and truth. And we'll continue to have these conversations and uplift the incredible efforts being led by organizations like yours, as well as the initiatives being led by the Black Mamas Matter Alliance. Have a great night.
Thank you so much.